Welcome to the weekly Dear Dr. Mao. I hope you've enjoyed the Balance and Restore series in this past month and that it has helped you to get on the path to better health of mind and body. February is Heart Health Month, so today I would like to start off the month by talking about integrating the best of Eastern and Western medicine for your heart. The unfortunate fact is that one person dies every 30 seconds from cardiovascular disease in the US. That's one in every 4 deaths. And the saddest part of this, much of the deaths were preventable. Yes, that's right. People die unnecessarily from heart disease. How? More on this later. There's no question that technology in medicine has saved many lives. Procedures like angioplasty, where a little balloon is inserted into your blood vessel to prop open the closed artery, and the traditional bypass surgery that grafts a vein from your leg onto your heart as a new blood vessel, supplying much needed blood flow to the heart muscle. New wearable devices such as the latest Apple Watch can monitor irregular rhythm in your heart and can even send an alert to 911 if you should suddenly collapse or fall. A defibrillator can shock your heart back to normal heartbeat. These represent the crowning achievement of Western medicine in emergency care. However, these procedures and devices relieve symptoms only and do not prevent future heart attack or heart disease from progressing. What's needed is a preventive approach before the disease progresses to the point of threatening your life. Now, this is where Chinese medicine comes in. You see, for thousands of years in China, heart disease has been, for the most part, effectively prevented by following a holistic principle of disease prevention which promotes a healthy diet and nutrition, sustainable lifestyle, effective stress management, and acupuncture and herbal medicine. It turns out modern science has also discovered that these practices actually are the most effective way to prevent heart disease. Dr. T. Colin Campbell and his colleagues from Cornell University, Oxford University, and the Chinese Academy of Preventive Medicine conducted their research on 6,500 subjects throughout China over a 20-year period in the 70s and 80s. And to their amazement, they discovered that the Chinese suffered little to no heart disease as well as diabetes and cancer, contrasted with their American counterpart. The China study, the research project would later be called, which was also the title of Dr. Campbell's book, was a landmark revelation of the irrefutable connection between diet and lifestyle and the modern disease of the cardiovascular system. So what exactly did Dr. Campbell and his colleagues discover in China? Here are the three most important findings. First, heart disease can be reversed through nutrition. The study concluded that a plant-based diet can reverse plaque and open up clogged arteries. It appears that both Dr. Cadwell Esselstyn of Cleveland Clinic, the best cardiac center in the country, and Dr. Dean Ornish of Harvard Medical School came to the same conclusion, and other studies have also confirmed the efficacy of a plant-based diet. Second, carbs are not the enemy. It's the type of carbs that matter. For example, highly processed refined carbohydrates like white bread, white pasta, white rice, cookies, cakes, and anything laden with sugar and processed starch are simply bad for you. Period. However, whole grains like whole oats, brown rice, quinoa, beans, and legumes are wonderful for your health, especially heart health. Third, animal protein promotes cancer and increases your risk for heart disease. It's simple. Animal protein, except fish, has saturated fat and packed with toxins, hormones, and drugs accumulated through their life cycle that can be dangerous to your health over time. High-protein diets like Atkins, paleo, or keto diets may help you lose weight in the short term, but you'll be sacrificing your long-term health. If you want animal protein or fish, do what the Chinese did back in the 70s. Small amounts during festivities and special occasions. Ironically, China has become a victim of its own economic success. With a rising standard of living and an influx of Western exports into China, mainly our fast foods, sodas, and a taste for animal products, rates of heart disease, diabetes, and cancer, which were almost unknown back in the 70s and 80s, have risen drastically ever since. Now, nature's gift in keeping cholesterol and blood pressure in check involves an abundance of herbs and spices that we can easily incorporate into our cooking that can improve our heart health. For example, red yeast rice, a naturally fermented ingredient prized in traditional Chinese cooking for its umami taste. Studies found that red yeast rice contains beta sterols, monounsaturated fatty acids, and other nutrients that lowers LDL, the bad cholesterol, as well as blood pressure and blood sugar, a triple winner. At home, I use the red yeast rice with Himalayan salt combo and use for seasoning of all my food. Many patients started asking for it, so we decided to share it with our friends. So if you like to try it, ask for it next time you're at a Dial Wellness office, or go to dialstar.com and order the red yeast rice Himalayan salt for your heart health. Another indispensable spice in a Chinese kitchen is ginger root, which besides its well-known property of relieving nausea, has also been found to lower total cholesterol, LDL cholesterol, triglycerides, and blood sugar. Additionally, ginger also offers potent antioxidant and anti-inflammatory effects, which further benefit the cardiovascular system. Finally, constituents in cinnamon, another common spice in a Chinese kitchen, also possesses cholesterol and blood sugar lowering properties. Sprinkle it in your oatmeal, add it to your tea or coffee, and cook with squash and pumpkins. Besides being delicious, it is good for you. In summary, integrating the wisdom of Chinese and Western medicine for prevention of heart disease starts with eating a plant-based diet, which is high in fiber and good carb, and reducing or eliminating animal products, and spice up your meals with red yeast rice, ginger, and cinnamon. I hope you found today's episode helpful. I invite you to join my brother, Dr. Dao, and I, along with other esteemed teachers, for the virtual health and wellness retreat starting next Wednesday from February 10th to the 14th. It will be filled with workshops in meditation, qigong, health, and nutrition. Go to collegeofdao.org and sign up today. You'll have access to all the recordings for 1 month afterwards. So if you can't attend any of these classes, you can tune in at any time. Now, next week, when I'll talk about skin and how it reflects your inner health. So don't miss that. Until then, live long, live strong, and live happy.